I'm going to be your student nurse today. Can I please get your first and last name and date of birth? Okay, I'm just going to check your wristband real quick. All right, so I'm here to change this wound dressing for you. This will help prevent infection and it'll promote your wound healing. It's just going to be a quick procedure. I'll take it off and put a new one on and clean it for you, okay? Does that sound okay? Okay, and then this is what I would do, my safety check. My bed is in the lowest position. It's locked. My patient looks comfortable, doesn't look like they're gonna fall over, wearing non-skid footwear, and I would make sure their call light was within reach. And then this is when I'm gonna check my order and then also review my institutional policies. And then this is when I'm gonna teach my patient. I'm gonna teach my patient, yes. So what this procedure entails is I'm going to remove that gauze, and then I'm going to look and make sure there's no signs of infection. I'm going to clean it, and then I'm going to place a new one on, and we'll be on our way. Hopefully that'll prevent any further infections or any bacteria getting in there. Do you have any questions or concerns about that? No? Okay. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what are you at right now? Okay, and then I'm going to help my patient into a laying position. So could you lay down for me so I can get a good access at that wound? Thank you. All right, now I'm going to put some gloves on. All right, I'm going to use the push-pull method to get the tape off. Remove from the center. No drainage on this. I'm going to discard. I'm going to remove this. There is no drainage on here. There is no drainage coming out of our wound. It is slightly red around the edges, but that's to be expected with an abdominal wound. It's pretty deep. It's beefy red on the inside, which is what we want for a good healing wound. There's no odors. And there's no purulence, so it doesn't look like there's any infection. Now I'm gonna size it. All right, so the length of our wound is 14 centimeters, and then the width is around 3 centimeters, and then depth. I'm just going to stick this in the deepest part. Mm, 3 centimeters in depth. All right, I'm going to remove my gloves. Wash my hands. And then I'm going to prepare my supplies. And then I'll put a new pair of gloves on. I'm going to clean the outer, the dirtiest part first. and then I'm gonna clean the inside, one side. And then the other side. Alright, I'm gonna remove my gloves. Wash my hands again. And this is also if my patient had any medications. This is when I would be checking and doing my 3 checks and 11 writes and checking the medication order to give them. All right, and then this is when I'm going to pack the wound because it is quite deep of a wound, so I would expect drainage. And then I'm going to tape using the window pane method. And then I'm gonna throw away any supplies, remove my gloves, wash my hands. I'm going to initial, date, and time. And then I'm going to document that I did the dressing change. And then I'm going to come back and assess my patient. How are you doing? Are you doing okay after that? No pain? All right, sounds good. Thank you.